To take a look at some of the COVID-19 numbers, because as the KCPE begins, one of the concerns is exactly that. If you can take a look at the numbers of the situation currently in the country, as the tests that have been run, 1.4 million since March, or rather since the start of the pandemic back in 2020. The total infections so far detected are 120,910. The recoveries out of this are 74.1%, the fatalities 1.6%, and the active cases as we speak are 29,000. But the past 1 week has been the worst. Like I told you a few minutes ago, the new infections that have been reported since Monday last week and yesterday being Sunday was 7,674. That's an average of 1,096 infections every day. The new deaths are 98. That's an average of 14 on a daily basis. Again, one of the highest number of deaths in a single week since the pandemic began. As of now, the hospital burden, we know that 2,545 patients are reported to be under home-based care. Those that are in hospital are 889, and out of this, those in ICU are 121, and out of this, those that are under ventilatory support are 32, and those under supplemental oxygen are 86, and some 3 more on observation. Let's now take a look at the monthly infections and how this has been changing. You'll see from the start of the pandemic, since between March and May last year, until you can see that the first wave peaked sometimes in July, 14,270, then went down. Then the second wave peaked in November, where 28,426 new infections were reported. And now in the third wave, and so far it's just 21 days into the month, and 14,937 cases have been reported. All indications are that we may get closer to what November was last year. Then let's take a look at something else that will tell us about the situation. The monthly fatalities, this is how deaths have been reported. November last year reported their highest number of deaths at 473. You compare that to August during the first wave, that was the highest fatality rate reported at 236. And now in the third wave, March already has reported 155. Actually, that bar should be higher than that of February. But then again, it keeps changing, and we'll be seeing what that will mean before the end of the month. Something else to look at is about the positivity rate that has been rising over the past few weeks. You'll see that in September 2020, the positivity rate was at 4.7%, went up in November to 14.6%, and now in March, an average of 12.3%. So it's still not as high as it was in November when we had our second peak, but you can see it's on its way going up there. Joining us now is Professor Joachim Osur, a technical director at the AMREF Health Africa. He's also the chairperson of the University Council of Murang'a University. Good morning, Prof, and also Dr. James Nyikal, who is joining us online. Prof, let me begin with you. And at the start of this examination, and all these concerns, we hear Dr. Ngani saying that the number of people admitted in ICU being reported at 121 may not really reflect the reality on the ground. How do you reconcile these numbers, and what are they telling you against what is on the ground?
To say that the cases are going up at a very high rate, and we are able to count some cases of those who have been tested. Not everyone is getting tested, and not everyone is able to access an ICU facility. And so even the deaths that we see reported are likely to be much higher, because when someone dies in the village without being tested, you cannot count them as COVID. So what we are seeing is the tip of the iceberg, and we hope that we are counting as many as we can, but definitely there is a crisis we are getting into, because we are also told that right now in most hospitals, when you're sick and you need ICU care or oxygen, you may not get it. The places are full.
Right. And Dr. James Nyikal, what are your concerns with these numbers and the start of an examination at a time, yes, people are being sensitized to wear their masks, to keep their distance, to wash their hands, but the numbers keep rising?
Well, what we are seeing is the result of what we didn't do earlier. When we actually relaxed, the guidelines were not followed as was indicated in the president's speech. we had to reduce social distancing numbers in public places, like in churches, in funerals, in weddings. But if you looked in meetings, in political meetings, when then you looked, people just went back as if we were back to completely normal. Many churches went to full crowds, funerals went to full crowds, weddings went to full crowds. Social distancing has been our biggest failure. There was a little effort. The hotel industry actually tried to reduce the number of chairs and the distances. I think I saw that. Other than that, we didn't do proper social distancing. Look at public transport. You look at matatus. So just came from Kisumu the other day, and as you're passing, the matatus are packed. A few people are wearing masks. Masks are a little better, a little more people are wearing, but they are packed. Nobody seems to be looking at the numbers in public transport vehicles, buses, and matatus. And what you are seeing now is the results of what happened then. There was an effort in schools, but even then, I don't think we had enough infrastructure to actually give us the appropriate social distancing we needed. We felt that we need to distribute masks to all the children. But let me say, in school, there's been an effort. You go to schools and you find most children have masks. So we relaxed too much. And in my view, they are calling first wave, second wave, third wave. My view is that this is one wave. When we reacted firmly with lockdown and proper control of social distancing and masking and hand washing and sanitizing, the numbers went down. When we went to 3% positivity rate, then we relaxed, and we relaxed completely instead of just reducing the measures. So what we are seeing is what's happening. And Professor Sur is right. We need to know also what is happening in the rural areas where there's no testing.
Right.
It is my observation that the number of deaths, particularly amongst the elders, has increased. Do we know what they are dying from if they don't get to hospitals? There are things like verbal autopsy where we can make an effort to find out this person who died. Is it possible that they died from COVID-19 related complications?
Right.
Now, we are not doing that. So what we are seeing, as Professor Su said, is probably the tip of the iceberg.
All right, tip of the iceberg.
I am concerned.
Just a moment, Dr. James Nyikal, I want us to bring in your colleague at the Senate, that is Senator Sylvia Kasanga, nominated Senator and former chair of the Ad Hoc Committee on COVID-19. And Senator, your concerns at this point in time when 1.1 million learners get to write their final examinations at the primary school level?
Thank you so much, Sam, and thank you again for having me. As you know, Sam, when we were chairing the Ad Hoc Committee on COVID, our worry was always how prepared are the counties when it comes to their preparedness for handling matters of COVID. And as you can see, you know, our concerns are coming to pass. Our concerns are definitely coming to pass. And we have to revisit some of the conversations that we had at that time when we were at the height of monitoring what had happened. Although the Ad Hoc Committee, of course, was wound up, it is my sincere hope that parliamentarians can pick it up, can pick up their monitoring aspect and see where we left off, what have the counties been able to achieve, you know, in terms of their rollout of what was required of them by the Ministry of Health. Some, you know, our students, of course, are at risk, but our teachers mostly are at risk, especially the more vulnerable ones and the older ones.
Right.
And although the vaccine now is here and we are encouraging all the teachers to go out and get the vaccine as soon as they can, the fact does remain that the citizens right now are at risk, with the issues being a tip of the iceberg, as the other panelists have said. Then how prepared are the counties? The Auditor General did a very comprehensive report on the utilization of COVID funds by the counties. And this was the last request that the Ad Hoc Committee on COVID had done before we were wound up. And that report was tabled in Parliament in December and is yet to be picked up on either by the Committee of Health or by the Committee of Public Accounts Affairs, so that they can see really what has happened. And the report is very telling, how the underutilization of the funds that were sent to the county governments happened. And this is very worrying, because right now, the capacity with which the counties needed to have built by now should be impactful. We should be feeling it.
And Senator, your committee obviously came to its end of life, but then again, after that report by the Auditor General, was anything done to ensure that all the errors were corrected?
Well, it's yet to be picked up on in Parliament. As you know, again, because of COVID, Parliament, the wheels are turning a bit slowly, because we are not fully, fully at work in Parliament. But I believe it will be picked up on by the Health Committee and the Committee of Public Accounts. Right. And even individual members of Parliament should pick up on what, the highlights from each of the counties, because the report is quite comprehensive, so that we can follow up on some of these things. Because the items that have been outlined by the Auditor General are things that we need to deal with as citizens and as representatives of the people. So in as much as we are wishing our candidates the best, both in KCPE and KCSC, our teachers really do need to take the vaccines. I think that is most critical, because they are frontline workers, and that will also help, to handle the children as they do their exams, and all the other children as they go back to school, because the Ministry of Education has really tried to get back things into schedule, after it had been of course thrown out of schedule because of the COVID issues. But yes, there's a lot that still needs to be done.
All right, Senator Kasanga, Dr. Nyikal, Dr. Ngani and Professor Sul, stay on the line, but I want us to go now to Kisumu County.